Good morning, members of parliament, support staff, radio listeners, TV viewers, those following via social media, guests in the public tribune, and members of the media. Welcome to the continuation of public meeting number 16 of today, Thursday, May 22nd, 2025. I would like to give a special welcome to the Honorable Minister of Public Health, Social Development and Labor, Mr. Brug, and his support staff. We have established a quorum of 10 members. Please stand for a moment of silence. Thank you. I have received notice of absence from the following members: MP Egbert Doran, MP Westcott Williams. I have also received notice of lateness from member MP Peterson. Are there any notifications from the members of the floor of parliament? That does not seem to be the case. We have as agenda point for this public meeting deliberations with the Minister of Public Health, Social Development and Labor regarding recent developments in mental health care on Sint Maarten. This is noted under IS number 630-2024-2025, dated February 20th, 2025. This agenda point was requested by MP Ottley, MP Lacroes, and MP York. Before we go over to the agenda point, as this is a public meeting, allow me to remind you of the usage of interruptions during public meetings. The following guideline applies in accordance to Article 43 of the Rules of Order. The chairperson may permit interruptions. These interruptions should aim to seek clarification, challenge assertions, or contribute additional information, and should consist of brief remarks or questions without introduction. The chairperson will ensure order and decorum during the meetings and the use of interruptions. Members, ministers, and guests must maintain parliamentary decorum and refrain from making offensive or disorderly interruptions. Members will be allowed 3 interruptions per agenda point. The interruptions are to be posed from the lectern placed in the Legislative Hall. We now go over to the agenda point. On February 20th, 2025, Parliament received a letter, as mentioned on the IS number 630-2024-2025, dated February 20th, 2025, from MP Ottley, MP Lacroes, and MP York, with a request that a public meeting of Parliament be convened to discuss the above-mentioned agenda point. The presence of the Minister of Public Health, Social Development and Labor was also requested. The meeting was convened on May 7th, 2025, during which Agenda Point 1 was closed. At the handling of Agenda Point 2, the Honorable Minister of Public Health, Social Development and Labor, Mr. Brug, gave a presentation on the subject at hand. Thereafter, in accordance with the speakers list, members of Parliament were then given the opportunity to pose questions to the Minister in the first round. The meeting was then adjourned to allow the Minister time to prepare the answers to the questions posed by the members of Parliament. Hence today's continuation. I will now go over to giving the floor to the Honorable Minister of Public Health, Social Development and Labor, Mr. Brug, to provide the answers to the questions posed by the members of Parliament in the first round. Minister, you have the floor.
Thank you, Madam Chairlady. Blessed morning, members of Parliament, support staff, persons in the Tribune, and people of Sint Maarten listening through various media outlets. Madam Chairlady, before I address the question posed by the esteemed members of Parliament, I would like to share some introductory remarks. As mentioned during my presentation to Parliament 2 weeks ago, mental health is not merely a Ministry of Public Health, Social Development and Labor affair. It is the concern of the entire community of Sint Maarten. I fully acknowledge the crucial role that both my person and the ministry play in addressing the vital issues such as the construction of the new mental health facilities, the revision of the outdated mental health legislation, and the development of policies and a robust infrastructure for mental health care. I also recognize our responsibilities in tackling the immediate mental health crisis. However, it is through Parliament meetings like this one, along with similar sessions involving stakeholders and community incentives, that we can collectively understand that the demand for mental health care arises from underlying issues such as unemployment, the high cost of living, access to affordable, nutritious food, and an inadequate educational system. Therefore, it is essential that the mental health care in Sint Maarten is addressed through a holistic approach. I would also like to add that I agree with the suggestion of MP Irion to submit periodic updates on this topic to members of Parliament. Parliament can expect an update on this matter in the month of August. I would now go over to answering the question posed by the respective members of Parliament. First Member of Parliament, question posed by MP Roseburg. Yes. The deadline for technical support under the VSR legislation is July 1st, 2025. Does this date mark the finalization of the legislation? This date actually marks the end of the project funding by VNGE. By this date, the draft policy, also known as the Statennotatie, will be finalized and submitted to the Minister for approval. Question 2. What is the current status of the VSR policy related to the motion on involuntary admission? The motion refers to an interim measure that must lead to a draft policy within 6 months. On March 14, 2025, I informed Parliament by letter and provide an update at that time. I can now report that the discussion continued between myself and the Minister of Justice regarding the expected costs and responsibility of both ministries in this regard. The Minister of Justice is taking steps within her own ministry to address this, and in parallel, the Ministry of Health is in consultation with various chain partners to determine how the implementation of this interim measure should be shaped. At the same time, a ministerial decree has been drafted to establish legal representation for persons receiving mandatory care. This draft national decree containing general measures is currently undergoing the advisory review process. Those were all the questions posed by MP Roseburg. I will now continue with the questions posed by MP Lewis. First question. Can the Minister provide an update on the current state of mental health care facilities in Sint Maarten? Are there any plans to expand or upgrade these facilities in the near future to meet the growing demands for mental health services? At present, MP, the mental health facilities does not meet the basic standard required to provide safe and effective working environment for staff. Some of the most pressing concerns include severe environmental and structural issues such as mold, sewage problem, and a lack of daylight and proper ventilation. Many patients' rooms are without air conditioning, making them unsafe and uncomfortable, particularly in our climate. Inadequate bathroom facilities with limited toilets and showers that are often shared between patients, compromising hygiene and privacy. There is a clear intention to strengthen and better organize the mental health services through a phased, community-based approach. This includes building on existing services, 2, providing training in care and governance, 3, relocating current mental health foundation to a new facility. The first phase is underway, with Trimbos accessing current services in relation to the community's needs. And 4, transferring 1/3 of the 1.3 million guilders reserved for mental health foundation. Question 2. What measures are being taken to ensure that mental health services are accessible to all residents, particularly those in remote and underserved areas of Sint Maarten? Mental health services are currently available to all residents of the island. Mental Health Foundation is currently collaborating with the Community Help Desk and is able to utilize them for consultations. Moving forward, the community-based outreach approach is being assessed to ensure that access is better structured and coordinated. Together with Trimbos, we are working to improve collaboration among NGOs and partners united by the goals of creating a mentally healthier Sint Maarten. Question 3. Given the increasing importance of mental health, how much of the national health budget is allocated specifically to mental health services? Are there any plans to increase this allocation in light of the recent developments and needs? Sufficient funds have been allocated for mental health. A. Through the TWO and the VNGE, the ministry has received approximately 1.1 million guilders geared towards mental health. B. Through the World Bank, approximately 32 million guilders were allocated to mental health project that is currently being carried out by NRPB. C. Through a calm decision on June 2024, 2.5 million guilders were allocated for the Mental Health Foundation. Question 4. Does Sint Maarten have sufficient mental health professionals, such as psychiatrists, psychologists, and counselors to meet the demands for services? What steps are being taken to recruit, train, and retain qualified professionals in the mental health sector? No. Sint Maarten is no exception to the global reality of structural shortage in the medical professionals. Nevertheless, we are addressing this issue by adjusting our approach to mental health service delivery. Shifting from traditional institutional model to a community-based approach is the first step. This change will not only lower the threshold for accessing service, but also help bridge capacity gaps by strengthening the skills of existing professionals. Additionally, active recruitment of psychiatrists, preferably from the region, is ongoing. In addition, we have started pushing on prevention sessions for parents, teachers, and other caretakers. All these sessions organized since I have taken office are geared towards prevention. Question 5. What strategies are being implemented to raise awareness about mental health issues among the general public? Are there any initiatives to reduce the stigma surrounding mental health and encourage individuals to seek help when needed? Since taking office, the Cabinet has implemented various strategies to raise awareness about mental health among the general public and reduce stigma. This is being done in collaboration with local organizations such as Men's Health Awareness Foundation and Spectrum Support Box, through activities like workshops on youth and parental support, the When to Ring the Bell workshop, an interscholastic spoken words competition, and awareness symposiums. In addition, mental health initiatives such as online sessions, prevention programs, including a suicide prevention session with the Victorious Living, and interactive soundboard sessions with stakeholders are being organized. These initiatives aim to strengthen knowledge, promote openness, and encourage people to seek help in a timely manner when needed. Internally within government, mental health is also a focus with activities such as Sports Day and training for management to recognize and address signs of burnout. It is my intention to keep this momentum going. Changes doesn't happen after a single effort. It requires repetition, deeper engagement, and continuous commitment. That is my mission when it comes to mental health, creating lasting impact through consistent and sustainable actions. Question 6. Is Sint Maarten collaborating with international mental health organizations or neighboring countries to enhance its mental health care services? If so, can you provide examples of such collaborations and their impact? Yes, Sint Maarten is working with several international and regional partners to improve mental health services. PAHO helps Sint Maarten find gaps in its mental health services and create long-term plans to improve them. Trimbus Institute provides research support, expert advice, and training to build the skills of the local mental health workers. Rhino Zoid offers educational programs to train mental health professionals. Sint Maarten also takes part in the Federation Dutch Caribbean Mental Health, a group that includes partners from the Dutch Caribbean islands. This helps the Mental Health Foundation to discuss shared challenges and work together on solutions in the region. Question 7. Is the government ensuring that vulnerable groups such as children, the elderly, and individuals living with disabilities have access to appropriate mental health care service? While I recognize that there are gaps in the current system, we currently provide care for vulnerable individuals. Services targeted to specific groups are currently delivered through various foundations. For example, the White and Yellow Cross provides elderly care for individuals with intellectual disabilities, while Turning Point offers services for individuals struggling with addiction. Additionally, mental health services can also be accessed through referral from family physicians or the Department of Social Services. The ministry is actively working to close existing gaps. This includes lowering the barriers of care through the implementation of community-based approaches and improving the structure and coordination of existing foundation that currently offers care on a limited scale. Question 8. With the increasing use of technology, is there any consideration being given to telemedicine or digital mental health platform as part of the government's strategy to improve access to mental health services in Sint Maarten? Telehealth options are currently being explored, although all full system is not yet in place. The draft National Strategic Mental Health Plan includes telemedicine as part of its vision, recognizing that hybrid models combining digital and impersonal care are often more effective than digital-only approach. While the technology is largely available, we are only at the starting point, and a coordinated evidence-based strategy is needed for sustainable implementation. It's also important to acknowledge that technology is not yet accessible to everyone. Many individuals lack internet access, personal devices, or the privacy needed for virtual care. These realities must be considered as we move forward. Full implementation of telehealth will require a legislative review to ensure patients' rights are fully protected. Question number 9. What systems are in place for individuals experiencing mental health crisis? Are there enough resources for immediate intervention and support in emergency situations? Right now, persons going through a mental health crisis are helped by the Mental Health Foundation. They have a special crisis team made up of trained nurses, case managers, and an on-call psychiatrist. This team steps in to assess and support people in urgent situations. However, there are only a few emergency beds available, so the system can become overwhelming when there are multiple cases simultaneously. Plans are in place to add proper crisis room in the new facility for Mental Health Foundation when it's built. In the meantime, the Mental Health Foundation team works closely with the family doctor, the hospital, and the police to help respond when someone is in crisis or at risk of becoming a crisis patient. While there is a basic system in place, I do recognize the need for more resources and better coordination to ensure everyone gets the timely and proper care in an emergency. Question number 10. How does the Ministry of Health evaluate the effectiveness of mental health care programs in Sint Maarten? Are there any plans for future assessment or audit of the mental health service available to ensure they meet international standards? At present, the Ministry of Health does not have a structural system in place to regularly evaluate the effectiveness of the mental health care programs. This is largely due to a significant shortage of staff within the departments responsible, which limits the ministry's capacity to conduct formal monitoring and evaluation. However, this gap is being addressed as part of the current reform efforts. A monitoring and evaluation framework is being developed with the support of the Trimbos Institute. This framework would help track the performance and quality of mental health care service going forward. Plans also include the introduction of standardized protocol, clinical guidance, and the referral system. These measures aim to improve consistencies in care, ensure quality, and bring service more in line with international standards. Question number 11. Given the mental health challenges arrived from COVID-19 pandemic, what specific measures have been implemented to address the increased needs for mental health support during and after the crisis? The compounded trauma caused by Hurricane Irma and the COVID-19 pandemic left many individuals facing emotional and psychological strain, compounded by unemployment, lack of access to care, and limited social support. Immediate intervention during the pandemic were limited. To address this, the government is prioritizing two major pillars. One, the finalization of the National Mental Health Strategic Plan. Two, the completion of the new mental health facility funded through the trust fund. These initiatives are aimed at strengthening our mental health infrastructure to meet both short-term and mid-term needs. These include plans to expand community-based services, improve crisis response capacity, and enhance working force development implementation, among other standardized protocols and guidelines, just to mention a few. Question number 12. Can the minister outline the government's long-term vision for mental health care in Sint Maarten? Are there any new policies or initiatives on the horizon aimed at improving the mental health landscape for residents? The government's long-term vision for mental health care in Sint Maarten focuses on a person-centered and a community-based approach that promotes prevention, better access, and reduced stigma. We are developing new policies and programs that encourage different sectors to work together, such as healthcare, education, justice, social services, labor, housing, and NGOs. Examples include mental health support in schools and training for teachers, programs to divert people with mental health illness away from the justice system and provide proper care, coordinated help for vulnerable families and support for caregivers, workplace mental health initiative and support for employees, housing programs for those with serious mental health needs, partnership with churches and community leaders to promote understanding and reduce stigma. These efforts aim to improve the overall quality of mental health care and make sure everyone in Sint Maarten can get the support they need. Question 13. How is mental health being integrated into general health care service in Sint Maarten? Is there a coordinated approach between primary care providers and mental health professionals to ensure holistic care? Mental health integration into general health care is being supported through 1. The implementation of training for family physicians. 2. Strengthening collaboration with primary care networks. 3. Developing and introducing standardized protocol, clinical guidelines, and referral system. These efforts aim to improve early identification, referral, and basic management of common mental health conditions within primary care settings. Question 14. What support is being provided for families and caregivers of individuals with mental health conditions? Are there any programs or resources available to assist them in managing the challenges associated with caregiving? While there is currently no formal or subsidized system of caregiver support on the island, various efforts have been made to increase knowledge and awareness among families and informal caregivers of individuals with mental health challenges. This includes workshops and information sessions provided by mental health organizations, foundations, and, as mentioned before, on the initiatives of the ministry itself. These initiatives aim to equip families with practical tools for understanding and supporting their loved ones. The National Mental Health Strategic Plan also recognizes the importance of caregivers' involvement and outlines future plans to develop structured programs such as peer support groups and caregivers' education. However, implementation of these elements remain in the early stage and comprehensive support services are still limited. Question 15. What specific measures are being taken to address mental health issues among youth population in Sint Maarten? Are there school-based mental health programs or youth outreach initiatives in place? And if so, what are some of these programs or initiatives? What is government doing in collaboration with those different organizations together to reduce the risk, for example, youths who commit suicide? At present, youth mental health support is fragmented, with more services provided by SSSD and a few NGOs who offer youth-centered programs with psychosocial elements. I have not been informed of formally of a system-wide school-based mental health program. However, I commend those schools who take the initiative to invite psychologists or social workers on an ad hoc basis. To better coordinate this, the ministry has started talking with the Ministry of Education, Culture, Youth and Sport and community organizations on working in collaboration to develop more structured and cultural sensitive interventions. Key recommendations in development or considerations include training teachers and school counselors to identify early signs of emotional distress. This initiative will commence in the second half of 2025. Introducing peer mentorship and youth ambassadors in secondary schools. 3, expanding access to afternoon school programs that incorporate mental well-being, sports, and creative arts. 4, developing a youth suicide prevention protocol, including crisis referral procedures and emergency support lines. 5, hosting community dialogue and awareness campaigns to reduce stigma around mental health and suicide. In the meantime, this upcoming Saturday, May 24th, the ministry will be hosting the initiative, When to Ring the Bell, supporting youth mental health at the government building. This informative workshop is designed for parents, caregivers, foster parents, teachers, youth workers, and anyone supporting a child or a teen. These sessions focuses on recognizing early signs of mental distress, such as depression symptoms, starting supportive conversations, and knowing when and how to intervene. In addition, we are currently developing a new initiative aimed at engaging youth directly through social media with the goal of making mental health a more approachable and open topic among young people. Question 16. How is the government addressing the intersection of mental health and substance abuse disorder? Are there adequate resources for individuals dealing with both conditions simultaneously? Currently, a new collaboration has been established between Mental Health Foundation and Turning Point, with regular joint discussion on patients presenting with both mental health and substance use disorders. In addition, specialized training and education programs are being developed to enhance the capacity of professionals to deliver evidence-based addiction and dual diagnosis care. However, the available resources for individuals dealing with co-occurring conditions remain insufficient. To address this matter, we are in the process of designing care and treatment protocols that will integrate dual diagnosis care into coordinated treatment and pathway. By doing this, we will ensure that the individuals with co-occurring conditions receive comprehensive, person-centered support. Sorry? No, not in there. Question 17. In light of the recent natural disasters, such as hurricane, what specific psychosocial support services are available for individuals affected by trauma, and how is the government ensuring they receive the care they need? Crisis counseling and mental health first aid have been incorporated into response of ESF 7 following a crisis or disaster. First responders, as well as volunteers such as Community Emergency Response Team, have been trained in psychological first aid through the Emergency Support Function 7 program. These efforts aim to equip frontline personnel as well as volunteers with basic skills to identify and support individuals experiencing acute psychological distress during and after disasters. However, overall structured psychosocial support services such as trauma-informed community outreach, grief counseling, or post-disaster debriefing programs remain limited. These services are available solely based on the current referral system. Within short, a mental health first aid training is scheduled to be carried out for volunteers. Additionally, mental health psychosocial service response in schools is coordinated by SSSD. Question 18. How accessible is telehealth for mental health services in Sint Maarten, particularly for those who live in areas where physical mental health facilities are scarce? Is the government exploring partnership with tech companies to improve telehealth infrastructure? Exploration of telehealth platform is currently underway. As such, a structural system is not yet in place. Telemedicine will also be addressed in the forefront of the National Strategic Mental Health Plan. However, it is important to note that the mental health care hybrid model, which combines the digital and in-person service, are generally preferred and more effective than the pure digital or telemedicine-based approach. The technological infrastructure largely exists. What is needed now is an integrated science-based strategy to implement these services effectively and sustainably, and a legislative base which guarantee the patient's rights are upheld. Question 19. What steps are being taken to address mental health in the workplace? Is there any legislation or policy being considered to promote mental health awareness and well-being among employees, especially in high-stress industries? Mental health in the workplace, especially in high-stress industry, is increasingly recognized as a priority. During my time as Member of Parliament, I advocated for creating supportive work environment to promote employee well-being. However, it must be noted that the main reason behind limited work hours and making rest time mandatory, while also ensuring days for rest for all workers, is to promote decent work-life balance, thereby also promoting family time, which has been proven to reduce mental health incidents as a result of work. At present, Sint Maarten does not have specific legislation or a national policy focusing on mental health in the workplace. While current labor laws do include general provisions for occupational safety and health, they do not explicitly cover mental well-being or psychological safety. In the meantime, employers can rely on their insurance coverage to support employees through services such as occupational therapy and counseling or psychiatric care. Looking ahead, I intend to make use of the collaboration with Trimbus Institute to strengthen mental health services and develop targeted policies and legislations that promote mental health awareness and protection in the workplace. And the last question, question number 20 of MP Lewis. What data or research in the Ministry of Health, what data or research is the Ministry of Health using to guide on policy development regarding mental health care on Sint Maarten? Are there any plans to conduct more research on mental health trends in the population? Due to long-standing challenges in collecting structural data, the ministry currently relies on limited, mostly qualitative information to guide mental health policies development. There is no centralized electronic health record system in place yet, but efforts are underway to explore the implementation of such a system to improve data collection and monitoring. To address these gaps, the ministry is working closely with Trimbus Institute to develop a mental health framework tailored to Sint Maarten's specific context. This includes conducting comprehensive assessments to better understand mental health trends, service needs, and gaps in cares. These findings will inform future policies decisions and support evidence-based planning. Those were all the questions from MP Lewis. I will now move over to the questions of MP Irion. First question. What contingency plan is in place for mental health building for the upcoming hurricane season? The Mental Health Foundation updates its contingency plan annually in preparation for the hurricane season. This plan ensures that all departments, staff, and patients are informed and prepared well in advance of June 1st. Key preparedness actions included, but are not limited to, stocking essential medication and verifying that ambulant patients have sufficient supply to last through a potential emergency. Preparing printed and sealed patient lists for the ambulant nurses, case managers to ensure continuity of care and follow-up if digital system fails. Informing ambulant patients in advance about designated shelters they can access during a storm. Revising and distributing the evacuation plan to all staff. Mental Health is working in collaboration with the White and Yellow Cross to house crisis patients. And specific staff members are involved in Emergency Support Function 6, allowing coordination with National Emergency Services. These measures aim to protect the most vulnerable clients and ensure that mental health care can continue, even under emergency condition, until the new hurricane resilient facility is in operation. Question 2. Why was NRPB unwilling to share data? With whom were they unwilling to share it? The data referred to is the master schedule. This document was requested by my cabinet on more than one occasion. Eventually, some sort of makeshift schedule was provided, but it was not the actual master schedule. As a matter of fact, it was stated that the master schedule is technically a draft until all the required oversights and specifications results from this plan are in place. The master schedule is considered a living document that can change. And that if I required something more specific, I should send a formal request through the Prime Minister. Madam Chair Lady, I understand that the Prime Minister is the responsible minister for NRPB-related projects. But the mental health project falls directly under my supervision. And as such, I am in my rights to receive any and all requested documents related to this project. As a consequence of this, I decided that I needed to ensure that I have better oversights to understand and manage the process of the NRPB. And I am in the process of hiring a technical assistant. Question number 3. What actions are you or the Council of Ministers taking to hold the NRPB accountable?
Minister, moment. I'm seeing that MP Irion would like to make use of his interruption. Go ahead, MP Irion. You have the floor.
Thank you, Madam Chair. Good afternoon, Minister, support staff, colleagues. Minister, in my questioning regarding this situation, I also specifically asked a few other questions. I realize a lot of answers are not being taken up. I specifically asked, did you talk to the Prime Minister? Did you bring to the Council of Ministers? And what came out of those discussions? There were a couple other questions aligned with that. So I already want to know what actions did you take in regarding it? Because now you're saying that you will do, but I asked that question also.
Thank you, MP Irion. Minister, could you answer the interruption?
Okay.
Or is that question being answered in the following question?
Thank you, Madam Chair Lady. Thank you, MP Irion, for the interruption. I will continue answering the questions, and I'm sure it's in the presentation. And if anything is missing, then I will double back and also get that information for you. But that particular question that you stated on the interruption will be answered now.
You may continue, Minister.
What actions are you or the Council of Ministers taking to hold NRPB accountable? First action is the finalization of the recruitment process for the technical consultant by the Department of Public Health. Should serve as an important check and balance in moving the project forward. Additionally, the challenges faced by both myself and the Ministry will be addressed during the upcoming mission with NRPB and the World Bank in the first week of June. This will also be my first official opportunity to meet with the relevant World Bank stakeholders currently overseeing this project. So I see MP Irion still hasn't answered your question. So basically, your question was what step? Those are all the steps that I've taken so far. So I have not brought it to the Council of Ministers. I have nor the Prime Minister. That's why my answer is these are the steps that we took.
Thank you.
Through you, Madam Chair Lady.
Minister, you can continue. Before you continue, I'm seeing that MP Ottley is standing for his interruption. You have the floor, MP Ottley.
Thank you, Madam Chair. Madam Chair, I could be corrected, but to me, just as you stated, the mental health project fall directly under the Minister of ASR. When I was there was certain access and everything that was given directly to me as Minister of ASR. So when was this changed? Because I'm hearing a different story now. This was never like that. So I'd like to know, when was this change, and was it sent officially, this change?
Thank you, MP Ottley. Minister, can you answer the interruption of MP Ottley?
Yeah.
You may go ahead. Minister, you have the floor.
There's no official documentation that this changed. I am not sure. But the ministry was never in possession of the master schedule. And basically that is the information that I've been requested.
Thank you, Minister. You may continue. Not as yet. I'm seeing another MP would like to make use of his interruption opportunity. MP York, you have the floor.
Thank you, Madam Chair. Minister, pertaining to the master schedule, putting on my engineer hat again, can't help it, but there are two different types of master schedules. You have the static one and you have the dynamic one. A static one can only change with formal approval by stakeholders, and a dynamic one is prone to change periodically. But the goal of that is to align, keep the stakeholders aligned with the project. The government is a stakeholder. So either way you turn it, government has to be involved. So if you're saying here, through you, Madam Chair, that you have no access to the master schedule, makes me question what is going on within government, between government and NRPB. Thank you.
Thank you, MP York. That was not really a question, it was a statement. So do you would like to say something, or would you like to continue?
I would like to continue. Thank you very much, MP York, for your comments. I am in full agreement with you.
You may continue.
That was a question 4, right? Yeah. Okay, I will continue. Question 4 for MP Irion. How was the 4-month period? How was the 4-month timeline determined? What data informed this estimate? How was that data obtained? And how realistic is the timeline considering the limitation in available information? The anticipated delay timeline was determined by comparing the anticipated signing date of the design with the actual signing date. This difference resulted in the recognition of the need for additional months. In any construction, Madam Chair, a master schedule is established with a baseline approach to monitor expected completion time versus actual completion time. Delays are usually included for various reasons. In order to mitigate future shocks, the ministry is diligently working along with NRPB to monitor the project and develop risk mitigation strategies. Question 5. Given the concerns about the existing mental health facilities, such as the lack of separate wings and mixed admission, can we assume that these issues have been addressed in the plans for the new facilities? Yes. The new mental health facility has been carefully designed to fix the problems seen in the current building. It will have a separate area for different types of care, such as short-term crisis care, long-term treatment, and care for young people. This will help prevent mixing different patient groups and improve safety, privacy, and the overall quality of care. The building will also use a flexible design, so space can be adjusted based on patient's need. It will follow a trauma-friendly approach, which means that space will be calming, respectful, and supportive for people who may have gone through difficult or traumatic experience. These improvements are based on what has and hasn't worked in the current facilities, as well as on international best practices. The overall goal is to create a modern, respectful, and recovery-focused mental health care environment. Question 6. The minister indicated that the focal point for mental health and NRPB will be leaving the ministry soon. Will the focal point be appointed from within the government or from an external party? And is there a budget allocated for either option? The outgoing policy advisor tasked with focal point responsibilities of NRPB projects will be leaving the ministry. Recruitment for this position will commence shortly. In addition, the Department of Public Health is in process of selecting a technical consultant to assist with the oversight of the mental health funded NRPB project. Question 7. What laws and regulations are being delayed, and what caused the delays? The reason for the delay in updating the mental health law is mainly due to limited capacity. There simply haven't been enough people or resources to move the process forward as planned. Currently, we are still using a mental health law from 1921. This law is more of a century old and focuses mainly on managing people in crisis. It does not reflect modern ideas about mental health, ongoing cares, or patients' rights. The new law aims to change that. It's being designed to be practical and realistic, especially given our relatively small scale and limited resources. It will avoid outdated and stigmatizing language and will cover not just care in facilities, but also ambulant care in order to provide support for people in their own surroundings. One of the most important goals is to protect the rights of the patients. This includes ensuring that any decisions to provide forced care is reviewed by a judge in line with European human rights standards. People in such situations will also have access to a lawyer free of charge. The law also meant to be future-proof. It will consider how healthcare continues to evolve and aim to remain affordable and adaptable. It may also provide legal basis to give each patient a case manager to help guide their care and coordinate services. And while the main focus is on improving care, the law will also include important rules to protect people's privacy and their information. Some of the more technical and changeable details will be managed through separate government decisions, so they can be updated more easily when needed. Question 8. Is there any legislation regarding the appointment of a focal point, at least in the form of a COM ministerial decree? No. At this point of time, we are still in the recruitment process. Question 9. How will the ministry ensure that the finding of the Trimbus financial cost-benefit analysis are translated into tangible budget allocated for 2025, 2026, and 2027 budget? Based on the outcome of the finding, the ministry will develop a detailed multi-annual implementation plan with proposed budget. Question 10. Is the FTE capacity at the Ministry of VSR being addressed in relation to the planned hiring of mental health professionals? And what is the timeline of this? Mental health specialists are hired by the different private mental health institutions and not through VSR FTEs. However, VSR is currently in the process of updating its own function book and is looking at adding a social worker or therapist FTE in staff bureau. Question 11. How is the Ministry of VSR addressing the hidden care needs of elderly, marginalized groups, and underrepresented populations? Unfortunately, gaps exist in the current system. However, there is care available for vulnerable groups through various foundations. For example, White and Yellow Cross supports the elderly and people with intellectual disabilities, while Turning Point assists individuals facing addiction. Additional services are accessible via referrals from family doctors or social services. Next to that, the ministry is working to improve access by strengthening community-based care and better coordinating existing support services. Question 12. What measures are being taken to strengthen outpatient care in order to prevent involuntary admission? The strengthening of outpatient care is a key priority within the ongoing mental health reform in Sint Maarten. Several measures are being proposed and gradually implemented to reduce resilience on involuntary admission and support early intervention. These include, among others, expansion of the ambulatory care service by introducing mobile crisis team and case management for high-risk individuals, improved coordination between mental health foundation, primary care providers, and community-based services, allowing for early detection of deterioration and faster referral into appropriate outpatient support. 3, integration of mental health triage and basic intervention into general practice through the training of GPs and community nurses. 4, further development of personalized care plans, relapse prevention strategies, and psychoeducation to support patient autonomy and continuity of care. Strengthening of family and caregivers' involvement to help monitor early warning signs and de-escalate potential crisis before hospitalization becomes necessary. Piloting assertive outreach models targeting individuals with a history of disengagement or repeat involuntary admissions. These steps are part of a broader effort embedded in the upcoming National Strategic Health Plan to shift the current system towards a more community-based, preventive, and a person-centered care system. The goal is to reduce the number and duration of involuntary admission by intervening early in the least restrictive and most supportive setting possible. Question 13. Is the ministry tracking attendance and measuring the impact of internal and external organized events? And if so, what are the findings? At the moment, the ministry does not have regular system to track attendance or measure the impact of mental health events. Sometimes names and informal feedbacks are collected, but this information isn't fully used to guide decisions. This is a missed chance to learn and improve. As part of mental health project, the ministry intends to introduce a basic system in 2026 to track attendance, gather feedback, and assess whether events lead to a real change in knowledge, or behavior. This will help ensure activities are meaningful, effective, and support long-term mental health goals. Question 14. How does the ministry plan to improve the monitoring and evaluation of external organized events in the future, particularly in terms of tracking attendance and assessing their impact? To address this, the ministry intends to introduce a basic monitoring evaluation system in 2026 as part of the mental health project. This will include simple tools and guidance that can also be used by external partners to report on attendance and gather feedback. The aim is to better understand the effectiveness of these events and ensure they support long-term mental health goals. Question 15. How will the minister address fragmentation in mental health when developing a cohesive, quality-based policy and implementation strategy? To reduce fragmentation in mental health care, the ministry is moving towards a more coordinated and unified approach. The plan is to focus on improving how different parts of the system works together. This includes healthcare providers, schools, police, and social services so that everyone is moving in the same direction and working towards a shared goal. We're also looking how to make it easier for people to move between services by improving referral and communication among agencies. This will help ensure that no one falls through the cracks when seeking support. In addition, we're developing clear, shared standards to guide how care should be delivered. These standards would help make sure services are consistent, of high quality, and based on best practices. We are also investing in better systems to support coordination, share critical information, and ensure accountability across the mental health network. Ongoing quality improvements is also a priority. We plan to regularly gather client feedback, carry out service evaluation, and provide ongoing training for staff to strengthen service delivery. To support these efforts, the ministry is currently receiving technical guidance from the Trimbos Institute. As part of this collaboration, a governance training session was held yesterday with the VSR management team to strengthen leadership and alignment in this area. Together, these steps will help shift mental health. Together, these steps would help shift mental health care on Sint Maarten from scattered and reactive to a more connected, consistent, and effective support for all. Now the last question of MP Irion, question 16. Where are all the initiative budgets budgeted for 2024? Please provide a list of all initiatives budgeted for 2024, as well as what is budgeted for 2025-2026. As is customary, when a budget is not approved as yet, the budget of the previous year is used as baseline. The ministry has different budget posts earmarked for projects in general, and in particular for public health related to prevention initiatives. As such, funds for current initiatives have been approved by the Ministry of Finance, as these are not considered new or different initiatives compared to what was budgeted for the 2024 budget. Considering the immediate need for a tangible mental health initiative, while TWO and NRPB long-term projects are being finalized alongside the skeleton budget for 2025, our focus for the first part of the year has been on partnering with and co-sponsoring of mental health initiatives. I mentioned in the PowerPoint presentation 2 weeks ago that the initiatives that were carried out by third parties. Since this month, my cabinet has identified a number of projects that will be carried out by the ministries until the end of 2025. These initiatives are currently being finalized through the official government advisory process. Once they are approved, these will be shared with Parliament. Once they are approved, these will be shared by Parliament. The ministry is currently in the process of identifying its projects for 2026 budgetary year. Those were all the questions for MP Irion.
Thank you, Minister. Before we go over to the questions of MP Leega, I'm going to adjourn the meeting for 10 minutes. Before doing so, I also would like to remind the public and give the notice that MP De Wever, notice of absence of MP De Wever. Meeting adjourned for 10 meetings. 10 minutes, sorry. I hereby reopen this meeting with the Minister of E.C present. I will go over to giving the Minister the floor so that he can continue with the answering of the questions of MP Leega. Minister, you have the floor. You can go ahead now, Minister.
Thank you, Madam Chair Lady. I will continue with the answering of the question for the next MP, which is MP Leega. MP Leega asks, I would like to receive the result of the STEP analysis. The Ministry has indeed received the initial results of the STEP survey. While the raw data is available and can be provided to Parliament, it is currently being translated in a manner that the general public can understand and not only the medical professionals. Once that translation is done, we have no problem sharing it with you, MP Leega, through you, Madam Chair Lady. I will continue next with the following questions for MP York. Can the Minister explain why the statistics of independent operating specialists and organizations such as Turning Points were not included in the presentation? The information presented was based on what was readily available within the Ministry. Data from the other independent providers such as Turning Point, private psychologists, is currently being collected by the Trimbos Institute, who is contracted for the mental health project. However, the subsequent report has not yet been submitted to the Ministry. Once the Trimbos report is received, we expect to have a more complete overview of the mental health landscape. Question 2. The patient treatment statistics lack context. Do they reflect an increase in illness or addiction? Or are they the result of greater awareness, demand, and reporting? It is not yet possible to say for sure whether the rise in mental health and addiction treatment numbers in Sint Maarten means that more people are getting sick or simply that more are seeking help. Most likely it's a combination of different things. To fully understand what drives the numbers, we need a more in-depth research. The upcoming National Strategic Mental Health Plan will help improve data collection and analysis so future decisions can be based on a clearer picture. Question number 3. What is the reason behind the report admission and treatment figure for youths under 15? And why was this not further elaborated? The current system does not yet allow for detailed real-time analysis of treatment figures, including those related to youth under 15. At present, retrieving this type of information requires manual work, and given the limited staff available who are focused on the direct patient care, it has not been feasible to conduct a deeper analysis at this time. Question 4. Besides the dependency of the new mental health foundation building, what is the Ministry doing to strengthen prevention efforts in mental health? While the new facility is an important step forward, the Ministry is also taking broader action to strengthen mental health prevention throughout the community. Key efforts include expanding community-based services that are more accessible and tailored to Sint Maarten's specific needs. 2, providing training for local professionals so they are better equipped to recognize and support early signs of mental health challenges, like integrating mental health into primary care, by training family doctors and frontline health workers to identify and respond to mental health concerns early. These steps are part of a larger strategy to shift the focus towards early support and prevention, rather than waiting for conditions to worsen before care is provided. Looking at the SAHA legislation, what provision does it include regarding mental health prevention? Access to mental health care is fully covered in the proposed care package of SAHA. What solutions are being implemented to address the current state of mental health foundation, such as mold and other concerns? Expert companies have been hired to address the mold situation. Funding for these repairs can be allocated from the portion of the mental health budget designated for improvement of the current building. What is the status of the 1.2 million guilders allocated in the June 2024 budget? As explained during the meeting of May 7th, while the funds were reserved in the 2024 budget amendment, the administrative steps to finalize the distribution of the mental health foundations were not completed. This oversight is currently being addressed to ensure that the funds are made available as intended. In the meantime, 1/3 of the initial 1.3 million guilders has been transferred or is in process of being transferred. What are the implications for subsidies for mental health after the construction of the new mental health building? At this point in time, there is no direct link between the construction of the new facility and subsidy for the mental health. What is the plan for recruitment, including local recruitment for the mental health facilities? Mental Health Foundation is planning to gradually move from approximately 50 to 60 FTEs once in the new facilities. The 10 additional FTEs will include 6 additional medical functions and 4 operational functions. Question 10. What is the ministry doing in terms of campaigning to show students how rewarding it is to work in healthcare or psychiatric care? Through you, Madam Chair Lady, the ministry Through you, Madam Chair, the ministry has done insufficient to attract students to work in the healthcare. However, we do recognize the need of such. All efforts are being made to correct this. Strengthening school engagement, the ministry sees great value in working closely with the Ministry of Education, Culture, Youth and Sports in the future to create early exposure to the healthcare careers in general within school systems, building local capacity in partnership with organizations like Trimbos Institute. The ministry is also developing training programs to strengthen the mental health workforce. These initiatives help define local careers pathway and build interest in the sector among students and young professionals. Question number 11. Regarding the delay at NRPB, is there a contingency plan in place if these delays continue? Yes. The contingency plan entails the hiring of a technical consultant who will be charged with the responsibility to develop and execute mitigation strategy that should lead to a reduced delay. Question 12. Regarding particular delay in procurement, not construction, can the minister explain the cause of this delay? Based on the limited information received in December and January, I concluded that At that time, there was either a miscalculation in the development of the master schedule, or that a finalized master schedule for VSA mental health project simply did not exist yet. This despite the fact that my cabinet had specifically requested this information in order to verify whether we were indeed on track, as was indicated by NRPB representative during my initial meeting with them. Question number 13. Is the minister in possession of the master schedule for the NRPB? And if so, can it be shared with the members of Parliament? If not, is this part of the information that has not been shared with the minister? And if that is the case, what is the minister's plan to obtain this information from NRPB? The ministry and I are in possession of a master schedule that were created by my independent consultant for the ministry. This was based on the limited information received from NRPB, the sessions that were attended as part of the assignment he received from my person, and his knowledge and experience of NRPB and World Bank procurement processes. As it relates to my plan to obtain this information from NRPB, this will be addressed in the first week of June during the World Bank mission on this project with representatives from the World Bank. As minister, I can understand that for certain complicated matters, such as, for example, request of extension regarding funds, or any other high-level matter, that I, as minister responsible for this project, would have to go through the Prime Minister. Regarding sharing this file with Parliament, please allow me to provide you with an update and most accurate file after the World Bank mission meeting in the first week of June. Question 14. What are the key findings regarding psychological support for the ministry? What action points are planned to ensure continuity moving forward? One of the main issues identified is that mental health support for government workers in general, and especially those in demanding roles such as first response, have not been consistent nor well organized. Support has mostly been provided on a case-by-case basis with no long-term system in place. Activities include team building, introduction of recovery space, individual consulting by an independent psychologist. Question 15. What is the minister doing to combat stigma and cultural barriers in mental health? One of the biggest steps is the development of the National Mental Health Plan, which will include public education, community involvement, services that are respectful to our culture and our people's value. Next to this, Trimbus Institute helps us build a system that fits our community and makes it easier for people to ask for help without feeling ashamed. Simultaneously, we support and initiate local awareness efforts like for instance, the Men Mental Health Awareness Foundation, Barbershop Talks, and high school group sessions. These programs create safe spaces for young people and men to talk openly about mental health. Last question by MP York, question 16. What outreach programs is the ministry planning to initiate, and which districts will be targeted first? The ministry, together with Trimbus Institute, is preparing to roll out new mental health outreach program that bring care directly into the community. These efforts aim to make mental health support more accessible and better suited to everyday needs. At this time, we are not using district-based approach. That's because there is no data yet showing which districts are more affected by mental health issues. Instead, outreach will be island-wide to ensure everyone has equal access to support no matter where they live. Planned activities include mental health checkups at social service desks, community workshops on managing stress and breaking stigma, and mobile outreach teams that visit people where they are, at home, in schools, or in the community. This is all part of the bigger plan to build a stronger, more inclusive mental health system for everyone in St. Maarten. Those were the questions posed by MP York. I will now continue with questions posed by MP Waver. Question 1. The person with keen knowledge of NRPB mental health project is leaving the ministry. Has this person already left? When is their departure scheduled? Will a proper handover take place? And who will be taken over? How is the ministry ensuring that this transition does not cause internal delays? Officially, the person's resignation goes in effect in June. A partial handover is currently taking place between current staff members of public health that are in the NRPB work group and technical consultant hired through TWO for the soft component of mental health. As it relates to the hard component, the construction of the new mental health foundation building, I trust that once the recruitment process for the technical consultant is finalized, a proper debriefing and handover will take place. Considering the internal delay, it is my hope that the process to recruit the technical consultant will be finalized within soon. Question number 2. Given the increase in cases among persons 15 years and younger, what is the ministry's vision for prevention healthcare campaigns within schools? Is there collaboration between the Ministry of VSA and the Ministry of Education, Culture, Youth and Sport, particularly targeting primary education and public schools? As explained earlier to MP Lewis, to reduce fragmentation in our mental health system, the ministry is taking concrete steps towards the upcoming National Strategic Mental Health Plan. This plan will help create a more coordinated and consistent system by 1. Aligning a dedicated coordinator within the ministry to ensure better collaboration between key partners like healthcare providers, school, police, and social services. 2. Improving referral and communication process so people can move smoothly between different services. 3. Establishing clear guidelines and procedures to ensure all services following the same standards and use best practices. 4. Strengthening data and tracking system to improve how services are monitored and held accountable. 5. Introducing regular quality check, including feedback from service users and continuous staff training. The goal is to move away from the scattered service and build a more connected, fair, and high-quality mental health system for all residents of Sint Maarten. In addition, discussions have begun with the Ministry of Education, Culture, Youth, and Sports and other partners to develop a better coordinated, culturally appropriate approach. Recommendations include training for teachers, peer mentors, afternoon school programs, and a suicide prevention protocol. Next to this, we are currently developing a new initiative aimed at engaging youths directly through social media, with the goal of making mental health a more approachable and open topic among young people. These are the questions for MP. Waiver. I will continue with the questions posed by the Honorable MP Jansen-Webster. Question 1. Can the minister share the capacity assessment findings document with Parliament? Preliminary raw data were shared by Trimbus via a presentation given to my person. In my presentation to Parliament, I shared the initial results of this assessment. And yes, MP, as soon as the full report is finalized, it will be shared with Parliament and all other mental health stakeholders. What I showed in my presentation was based on the initial results of the assessment, and I am still awaiting the final report. Question 2. Funds allocated for mental health in 2024 budget amendment. How were they used in 2024? Will this budget also be available in 2025? And if so, what will be used for, or what will it be used for, or is it already being utilized? Through you, Madam Chair Lady, unfortunately, the process to finalize the transfer of the 2024 allocated funds to mental health was not finalized in time to be taken up for the 2024 budget. However, these funds were secured in the 2025 budget and are already in the draft for 2026 budget for VSR. An initial payment condition was decided by COM in June of 2024. Correction. In a COM decision of June 2024, an initial payment with conditions were agreed upon for mental health, which will be made possible this week. Based on COM decision of 2024, an initial payment has already been made to mental health this week. All right. Question number 3. Has a portion of the mental health funds been used for current health intervention within the Ministry for civil servants? Madam Chair Lady, none of the funds specifically earmarked for mental health based on the COM decision of June 2024 has been used for the current mental health intervention within the ministry. It would be irresponsible of my person to do so. Furthermore, I am sure that the checks and balances in the government apparatus, in particular within the Ministry of VSR, would not allow me to do such. Question 4. Can mental health care for uninsured patients be covered under the current mental health budget? What currently can be done is crisis care. Crisis care is covered for all persons regardless of their insurance status. The allocated 2.5 million guilders are funds for the purpose, the allocated 2.5 million guilders are funds for the purpose of funding operational and infrastructure costs and cannot be used for care. Question 5. Are there any subsidies planned for 2026? Initiatives like Spectrum Support Box, which support both autism and Alzheimer's. As a ministry, we are pleased to collaborate with organizations who support autism and Alzheimer's within the limitation of the 2026 budget. The ministry is working on a long-time plan that will assert that initiatives like these, along with other professionals, are included. Additionally, recently, the White and Yellow Cross Foundation received a permit to expand their services to provide much-needed care for the elderly, which includes attending the needs of persons suffering from Alzheimer's to have care throughout the day, while allowing their caretakers to go to work. Question 6. Regarding the person that is leaving with the knowledge of NRPB mental health project, was the recruitment for this position visible in the newspaper? The vacancy to replace the policy worker at Staff Bureau, who was also charged with the task related to managing NRPB project, has not yet been published. However, a tour was published in order to hire a consultant to assist with the mental health project. Question 7. There is no treatment specified for patients under 15 in the current legislation. There is a need for changes in this legislation. What other changes in mental health legislations are necessary? Through you, Madam Chair Lady, MP Jansen-Webster, you are absolutely correct. The current mental health law is outdated, especially regarding care for those under 15. A full review is underway at both the kingdom and local level. Key changes are being worked on, which includes legal provision for child and adolescent mental health care, including consent and safeguards, clear patient rights such as confidentiality, informed consent, and complaint mechanism. Next, updated rules for involuntary admission with proper review and protection. Recognition of community-based and outpatient care models. Better integration with health, education, and justice sector for coordinated care. Legal pathway for those with both psychiatric and substance use disorder. Licensing, and quality standards for mental health providers. These reforms will align St. Maarten's law with international conventions and are part of national strategic mental health plans. And the last question for MP Jansen-Webster, will there be a female and family section in the new mental health facility building? The concept for a new facility is designed with flexibility in mind. It will have sufficient space to ensure that male and female patients can be accommodated separately, which has been challenging in the past due to limited capacity. The building allows for the temporary area to be created as needed, for example, in a case of a family crisis. those were the end of all the questions for MP Jansen. In closing, Madam Chair Lady, I have now concluded the presentation, but before turning over the floor to you, I would like to share my personal views on the frustration that civil servants, not only in VSA, have been experiencing. I believe that some of these frustrations will be alleviated by the actions taken by the previous cabinet under Prime Minister Jacob, particularly through the efforts of former Minister Irion and the Union. Their initiatives to gradually index civil servant salary, increase vacation allowance, and acknowledge additional jubilee years deserves recognition. It is important to give credit where credit is due. Through you, Madam Chair Lady, the now MP can take a bow on behalf of the civil servants. Madam Chair Lady, I would like to also express my gratitude once again to the members of Parliament for their thoughtful question and suggestion regarding this important topic. As mentioned at the beginning of my presentation, I believe that this issue is such significant that I will provide regular update to members of Parliament moving forward. I thank you, Madam Chair Lady, and I await any clarification questions and ready to go to the second round.
Thank you, Minister Brug. Does any member have a point of clarification? That does seem to be the case. MP Irion, you have the floor for your clarification.
Good afternoon, Madam Chair, SG, members of Parliament, the Honourable Minister and his support staff, to those of you in the Tribune and the viewing public. Minister, thank you for that acknowledgement, not just to myself, but also the former Prime Minister. Her work, Severa Jacobs, her work, our work, the work of the prior administration in regards to the civil servants and the CCSU. I would also like to thank your Chief of Staff for her diligent work on that also, and the unions, of course. And I'm happy actually that the government continue this, and I believe that we will see a lot of happier civil servants going forward. And unfortunately, there are a few that won't get to experience this, but I'm hoping that the government does look into those that were affected and have records that can show emails back and forth, that we look at this current law and say, hey, let's still try and help those, especially when it comes to issues with the Bra 8 and so forth, and their payments. Thank you for that. You can soften me and take off 10% of my questions now. Minister, listen to your answers though. They all sound nice, sounds positive, but a majority of them, at least in the beginning, sounded like just a pie in the sky. A pie in the sky. No timelines, no money, no dates, nothing on execution. It just sounds like the typical answers that we get from this government. It sounds a lot like the marketplace story. It was good around campaign time, a year later, it still don't exist. And I can go down the whole trajectory of similar campaigns. For example, you mentioned one of them, the mental health support for teachers and students. Okay, when do you see this happening? Is there a budget to this? Is it budgeted in 2025? What's the timeline? Because as soon as you said that, teachers started message me one time. Are you going to support a care team? So how are you planning to execute these things? We can't just continue saying things out there, gaslighting people, but then you have no kind of substance behind of it. Housing support for mental health individuals. As soon as you said that, so I had a message the other day from someone who said, hey, I saw a young man on the side of the road. I offered him some money. He said, no, I don't want money. I just want food. And the individuals that, Minister, MP, do you know anyone any institution that could help me help this young man get off the road. And now today you're saying this, but what is the substance behind it? So when is this housing support supposed to come? When I did a quick scan of the budget. I don't see any housing subsidy. I don't see any plans on this. So, and we have the old budget 2025. So where is this in the ministry? Where is it outlined in the ministry? Where's the policies outlined in the budget? So we can't continue just stating all these things, right? Creating expectations. We're already halfway through the year. We're already 6 months in. Creating all these expectations, knowing that we're not going to execute certain things this year. So I hope in the future, when we get answers, we have some type of substance behind them, timelines, dates, how we plan to execute. All this pie in the sky, like we are beyond that now. We are beyond that. Let's start working on execution. If you're going to bring hope, bring real hope. Hope with actual possibilities of seeing this plan through, actual possibilities of execution. The population changing, and today, ain't 10, 15 years ago when we had social media, we could pull up things immediately now, all right? We can hold you accountable going forward, and we will hold you, not just me, the public also, will hold you accountable because
Through me,
mental
MP
health
Irion.
is a very sensitive topic. Sri Madam Chair, Minister, it's a very sensitive topic, and people don't want to have a high level of hope and not be able to see it come true. You mentioned developing clinical guidelines. At the same time, doctors messaged me also, okay, who are you developing these clinical guidelines with? Because they were not informed, you didn't call them in, so who are you doing this with? You also mentioned in one of the slides, I believe, answering myself, you said what is needed is now a science-based and legislative-based to guarantee patient safety. Has it started? So the science-based, has that process started? The legislative-based, has that started? Because you're saying what is needed, but what I want to hear is, yes, it is needed, but what I would want to hear through Madam Chair from the Minister is, this is what we are doing. Not that it's needed, but this is what we are doing. This is what we are starting to execute. This is the plan going forward for the science-based and the legislation. Minister, you mentioned that, replying to me, that mental care, the MHF, in times of need, or let's say after a hurricane, that they will take on more individuals or support. But if they themselves don't have space now currently, how can they, after a hurricane, now take on even more individuals? So how does that work? They're saying right now they don't have enough space, but you're saying in your answer to you, Madam Chair, that after, in case of a natural disaster, they have the ability to take on even more. How? I was disappointed in the answer regarding the whole NRPB situation. The last time you were here, you mentioned, I saw the frustration that you had, right, regarding not being able to get the answers or the data, etc. But the Prime Minister is a couple steps down from you. To hear that in June, you're going to meet with the World Bank, where the Prime Minister is on the steering committee. Mr. Hallman is right there. He's right down the road. I can't imagine that this is so urgent, so important to you, but we can't send an email, you can't call an urgent meeting to the Council of Ministers and have a discussion with the Prime Minister regarding the NRPB situation. Why do you have to wait until a meeting in June with the World Bank to discuss this? So that means to me is a lack of urgency, because we see for a lot of other situations with the government, when it's urgent, how they get together. When they assumed that we would have no parade for Carnival, you yourself were there, right? They got together to ensure the Carnival continue with the ambulance and fire trucks. So if this is so urgent for you, Madam Chair, for the Minister, then I would expect, at the very least, an email to go to the Prime Minister with your concerns. Not that you're going to take it up only in June. I was there as a Minister, MP Ottley was there as a Minister, MP Doran was there as a Minister, and we didn't have these issues. The ASP was led under myself, and anytime an email was sent to the Prime Minister, matter of fact, they would send directly to me. The Prime Minister would get updates from me. So I can't imagine there's so much change in 11 months. So, And I know if I had an issue, I would go direct to the Prime Minister. Either the NRP is going to update, or then they take over the project, or you take over the project. And that was made clear. So I would like real clarity on why you didn't contact the Prime Minister. And if you can't do that this week, why wait until June? My question regarding the focal point, you said, to you, Madam Chair, the Minister mentioned that they're in the recruitment process, but my question was very particular. Is there any decree that allows you to even have a focal point? So we've had in the past issues where persons are appointed as focal points, and you can ask any SG, you can ask any, and they were never paid. The expectation was created, you had to go through all kinds of loopholes, and I met the situation there. So not that we met this situation, and then we ended that process. So if you're going to hire a focal point, a decree, some legal basis has to be established already. And that's why I asked you, is the focal point going to be part of the government, or is the focal point going to be an outside person? Because then you need a different decree that allows even a toelacher to be appointed. So I'm asking again, is there any legal basis established for you to be able to hire a focal point before you start the recruitment process? Because to start the recruitment process, I'm assuming you need to have that basis. Because if you're recruiting me, I need to know I'm able to get a certain level of compensation. And then I asked also, and is that compensation budgeted within your ministry, or is it going to be taken up by P&O, for example? The Minister mentioned to you, Madam Chair, that the VSR is currently updating the function book for the ministry. My question regarding that, again, when did that process start then? Who is the tracker? Who's holding it? Is it P&O? Is it another entity? And when can we expect a final draft? The Minister mentioned to you, Madam Chair, events planning tool for 2026. Is that tool going to be implemented in 2026? So that means that in 2025 we can see this tool done, this project done to evaluate the impact of events. True, Madam Chair, the Minister mentioned that they're operating on the budget 2024, which means the initiatives are already set for 2024. So that would mean that then there are no new initiatives by the Minister for 2025. So the initiatives that we are doing now were already set, already in motion, or had to be already in play. Because without the budget, I said in English, er zijn dan geen wettelijke verplichtingen voor new initiatives, right? I'm assuming that can happen. So the initiatives that are there are initiatives that were already in motion from 2024, because you can't execute new initiatives without the budget 2025.
MP Irion, was that a clarification or is it a statement? Because this is a round of clarification. So what are you asking the Minister exactly?
That's a clarification because the Minister mentioned.
So you're clarifying for the Minister?
No, I'm asking a question.
Okay, that was the question.
There's a question mark at the end.
Okay, just to clarify.
Yes. So is the introduction, Madam Chair, to the question and then the question.
Okay.
That's how clarifications work.
I would like to mention to you, though, MP Irion, that clarification should be shorter than what you're currently doing, and I'm allowing you, but I am mentioning, seeing that there are other members that would like to clarify, to keep your clarification shorter. I also would like to, I would have to cut you off, and I wouldn't like to do that.
Thank you, Madam Chair.
Yes, you may continue with your clarification, short and direct. You may continue.
So can I get a timeline of clarifications so I can prepare myself? A minute, 2 minutes?
MP Irion, I made it clear to you, and if we look back at the footage, you are making use of your clarification and really thin line in asking new questions. I'm allowing you to do that, but I'm now asking you to be very concrete with your clarifications and ask clarification and not make your own clarifications on the clarification.
Understand,
so you
Madam
might
Chair.
continue now
my question to you,
in
Madam
regards
Chair.
to the clarification.
I know.
Thank
I'm
you.
asking you, Madam Chair, now. What is my time space for clarification so I can stick on time? I'm a timer on my laptop. So if it's a minute or two, I know my timeline. You mentioned new chair, new rules, so I want to ensure I stick within the new chair, new rules.
I do think that I was very clear, and if it's taking too long, I would cut you off on that.
Okay,
Yeah, you
thank
may
you.
continue with your clarification, MP Irion.
Thank you. Through Madam Chair, the minister mentioned that, no, the Prime Minister actually mentioned that he has secured 30 new hires. The minister mentioned that there's lack of staff in certain ministries. Out of the 30, are those any of hiring coming to VESA? The minister mentioned, through Madam Chair, a contingency plan. Yes, that's a new question. The minister mentioned a contingency plan. And then the minister also mentioned, through Madam Chair, that the fix for the plan is that he is hiring a consultant. But that would mean that you plan it in advance. I'm very confused. So contingency means if something goes wrong, this happens, right? So in terms of the delays, that's the question. But you already mentioned, Madam Chair, that you're hiring a consultant already. So is that a contingency, or you're hiring a consultant to not have delays? Last question, Minister. In answer to a question from MP Veronica Jansen, you mentioned that funds for the mental health were earmarked and paid out. How much was paid out and how much is the balance? That'll be all, Madam Chair. Hope I'm in my time. Thank you.
Thank you, MP Irion. I now go over to, let me see, MP York for his round of clarification. You have the floor, MP York.
Thank you, Madam Chair. Good afternoon to you. Good afternoon to the SG, the Minister and his support staff, guests in the Tribune, honorable colleagues, and the viewing public. Madam Chair, I just have a few short and concise questions for my clarification round. The Minister mentioned often of hiring technical assistants for the new mental health project. I would like to know what would be the exact function and exact tasks of this professional once hired. What will this professional be doing? Minister also, so can the Minister clarify that? The Minister also mentioned often a community-based approach. Can the Minister clarify what he means by that through you, Madam Chair? Often, the Minister also made mention of the National Strategic Health Plan. Can the Minister clarify when this will be ready? Also, while clarifying that, how far is it currently? Also, and if it's ways ahead, is a draft ready, and has the Minister read it or been able to peruse any contents of what is to come? The monitoring and evaluation framework that the Minister made mention of, can the Minister clarify when this will be available, or when this will be ready, finished? The Minister also made numerous mentions of the Institute Turning Point. I would like to know, can the Minister clarify, does Turning Point currently receive any subsidy from the Ministry of VESA? And can the Minister clarify, will that be, if not, will that be in the 2026 or 2025 budget that we are to receive? The Minister also made reference to the Trimbus Institute acquiring info from data from Turning Point. Can he clarify exactly what kind of data and what is the time, what's the time period for that? During the Minister's presentation, I lost count, and I don't know if that's a good thing or a bad thing. I lost count of the amount of projects that the Minister alluded to. Can I get a number of how many projects the Minister alluded to in his presentation? So just a concise number, whether it's 20 or 100, how many projects did the minister allude to in his presentation? Can the minister clarify that? And finally, for my clarification round, let me see. Oh, not yet. Rounding up, the 1.2 million guilders that in June something went wrong and signing off of the advice or whatever, can the minister clarify exactly what went wrong and who had to sign it? The minister also, through you, Madam Chair, made mention of not the master schedule, but a master schedule independently made by a consultant. Can the minister clarify and elaborate on that? And that would be it for my clarifications, Madam Chair. Thank you.
Thank you, MP York. I will now go over to MP Ottley for his clarification round. MP Ottley, you have the floor.
Thank you,
Based on the rules of order, although if you didn't ask no questions, you can have a clarification round.
I don't want me to ask questions. Thank you, Madam
MP
Chair.
Ottley, you have the floor.
Thank you to the viewing and listening public. Thank you to the Honorable Minister and support staff. Through you, Madam Chair, I'd like to start my clarifications by agreeing with my colleague, MP Irion. I, too, understand that the minister is trying to answer at the best of his ability, but not only being in the position, but I guess having knowledge of politics, I understand when you're saying sweet nothings. Because a lot of things that the minister is saying, and I'll elaborate, I know it's what he thinks we and the public want to hear, but there's different aspects when you're in the ministry. For example, Madam Chair, when MP Lewis asked about technology within mental health, if you listen, it sounds like the minister had no clear plans on the technology base. We are not the first or we are not the last. But the minister also stated that we will look into this and we have started that. What specifically have you started, Minister, as it results to technology within mental health? What timelines can be attributed to technology in mental health? I would like specifics. Also, as it relates, Madam Chair, through you, the minister speaks about technical assistance, hiring the most technical assistants I've ever seen. But I'd like to ask the minister, when I was there, through you, Madam Chair, we hired someone specifically, a consultant. Their job was to focus on mental health. Specifically, what happened to this, through you, Madam Chair, to the minister, what happened to this person? And you're telling me since then I have left, I've had someone after me, and now you, and since then there is no specific, through you, Madam Chair, consultant or technical assistant for mental health. If a mental health assistant is to be hired, then there's none. That's logic to me. Minister, you speak of the company Trimbos. It sounds to me, Minister, that all your plans is reliant on this company. I've heard nothing specific from the minister and his ministry as plans for mental health. Trimbos. I have a question then. What is the timeline? Has discussions start with this company? Can a date be presented on when all of these wonderful, beautiful, sweet nothings that Trimbos is supposed to supply will be supplied? Was this company selected by bid? How much is this company being paid? It was also mentioned that they were selected, but I would like clarification on how they were selected, Madam Chair, if I may put it like that. We spoke about staff training, and it was said that staff training will commence. When? What progress was done for the staff training? Timeline. Let's notify the people of St. Maarten. Also, Madam Chair, for clarity, the minister also mentioned that mental health provisions will be included in the SAHA. When is the SAHA to be expected? And also, will the minister include any additional changes, such as addiction, to the SAHA, seeing that the timeline is pushed back? Or will it be brought as is? We spoke about caregivers. The minister listed a barrage of stuff that was done. Now, while I commend the ministry for the initiative that will be coming, the minister spoke about initiatives that were done pertaining to caregivers, but no clear initiative. So what workshops did you speak of? Because it was mentioned. I would like the name of the workshops. I would like to know when was the last workshop and the dates of these workshops that the ministry did where it pertains to caregivers. Madam Chair, through you was mentioned mental health amongst youth. Madam Chair, again, the minister spoke about NGOs. The minister spoke about schools. Through you, Madam Chair, the question stated, what is the minister's and the ministry's plans pertaining to youth mental health? The minister stated that he started talks with education. What was the results of these talks? What is the plans and what is the timeline for you to get started through you, Madam Chair, as it pertains to mental health discussions with youth? Madam Chair, again, the minister also mentioned that there's an event coming up by the ministry, and I commend the ministry and the minister for this event that is coming up. But I would like to know the steps taken, especially with the Ministry of Education, to move forward. It was mentioned, but nothing specific. Through you, Madam Chair, I'd like to touch a bit on the NRPB saga. The minister mentioned that he was informed by NRPB that the NRPB falls under the Prime Minister and he would have to go through the Prime Minister to receive any information. Madam Chair, through my clarification, I asked, was this ever sent officially or in an email? And the minister said no. So how were you, through you, Madam Chair, how was the minister indicated that he cannot have access to the master plan and he has to go through the Prime Minister? Was it a verbal conversation? Was it a phone conversation? How was it if it was never officially sent via email? Also, Madam Chair, if mental health is such a priority and the master plan is such a priority, why haven't the minister taken the time to discuss with the Honorable Prime Minister to get the information? Because if this is such the case, Madam Chair, maybe a simple conversation with the Honorable Prime Minister, who is also your leader, who is also your party member, could have gotten you the information that we have needed to move forward and receive this master plan. So for there, I do not blame the Prime Minister, I do not blame NRPB, Madam Chair, I blame the Minister for negligence in not putting importance of mental health in this master plan in front. Unless the Prime Minister doesn't want to give it to you, so then you can clarify that. Madam Chair, the Honorable Minister came, the Honorable Minister, I sat and I listened, the Honorable Minister gave a timeline of the NRPB project. The Honorable Minister said, this is the timeline that NRPB predicts and this is the timeline that I predict. And how can the Minister predict any timeline when he don't even have the plans? Again, Madam Chair, it goes back to my first speech, sweet nothings. The Minister is trying to prepare us for what can be a delay. But the people don't need sweet nothings. The people need answers, Madam Chair. And that's the question I asked to the Honorable Minister. How can you create your own timeline through you, Madam Chair, when you do not even have the master plan and you have not been updated? This is your words, not mine. Madam Chair, I would leave it at that for this moment. And I await any answers to my clarification. And I hope that I fell within your guidelines of clarifications. Thank you.
Thank you, MP Ottley, for your clarifications. Indeed, you did. I will now go over to MP Jansen-Webster for her rounds of clarification. MP Jansen-Webster, you have the floor.
Thank you, Madam Chair. Good afternoon. Good afternoon to the Minister, and welcome to the Minister and his support staff. Good afternoon to my colleagues and the viewers and the public, Tribune, and also those listening in. I just have one clarification regarding the findings of the Trimbos report. Through you, Madam Chair, I would like to ask the Minister when, so the timeline, when will the information be shared? If he has an estimate, because then I can put it in my agenda and I can ask for it if I didn't get it. Thank you.
Thank you, MP Jansen-Webster. There does not seem to be another member that would like to make use of their clarification round. So I would like to thank the members of Parliament. I would now like to adjourn for 3 minutes verify with the minister when he can return to answer the point of clarification in the first round. Meeting adjourned for 3 minutes. Good afternoon. I hereby reopen the meeting with the Minister of VSA present. After having consultation with the VSA Minister, he would need some time to answer and prepare the answering to the points of the clarification. So therefore, I will adjourn the meeting until further notice. Meeting adjourned until further notice.